postgraduate sort of study. Some we have got to do on our own financial strength. And the third part is this. I'm at the end of my journey now. I also wanted maybe to look back, to reflect back on whatever we have been doing before. I've lost a few of my colleagues. I think they have gone to the next world. So I think try to see also, try to reflect whatever we've been doing, patients that we have operated, patients that we have not operated. So I would like maybe we spend about 1 to 2 minutes on the poem, The Road Not Taken by Robert Frost. Then the fourth and the fifth part is the most important part of this presentation. What is the enablers? Make sure that we can do the postgraduate surgery. I would like to talk about the three main components. It's the cognitive part, the knowledge part, and also the effective part. Because we still go to this mechanism so that we have got something which is standard. So even though there are many critics on this sort of cognitive, effective, and skill or psychomotor, but still these are the way to go forward. And the last part will be the future. So as you can see that if you see before you make any decision, as you can see, I put a few names: Hippocrates, Galen, Al-Razi, Al-Zahrawi, Ibn Sina, Edward Jenner, Elizabeth Blackwell, Louis Pasteur, Alexander Fleming, Jenner Abgati. You all know about the people, except that Elizabeth Blackwell is the supposed to be the first uh, lady doctor educated in UK and in United States. But even at that time, when she was a doctor, she got a fight with Florence Nightingale after the Crimean War. So you all must know that in our profession, we tend to go into a lot of arguments, but we must learn to disagree with, even though we don't agree. So, and as you go down, you can see the ABGAS score also. That's why, because I know the Convener is the gynecologist, and they are very much sort of know about ABGAS score and so on. But as you can see now, after COVID, I think Edward Jana is somebody we must look forward to. He is the son of a priest, and yet he is the one who put up the vaccination forward. Even though if you go back, ini penting juga to understand, Az-Zahrawi is the one who put up the vaccination concept way back in during the Abbasiyah time, but it is not published. So Az-Zahrawi is considered to be the father of operative surgery. I put up his name here because it was mentioned not by the Middle East surgeons, but this was mentioned by the French, by the Europeans, and also by the people in UK. But most important, I think, what you can see that in his treatise, Az-Zahawi put that for surgeons to be excellent, they must acquire knowledge from all other medical areas before they can start to operate. I think these are the key points that I wanted to stress later, that surgeon, we are supposed to be scientists, we are supposed to be at least minor chemists, we are supposed to be sort of the people who can go out and do research, and most important, we can be good communicator, so that we can transmit, we can translate, and we can make sure to the patient and the family that we are going to operate, that after the operations, their link with us is going to be continuous. Sometimes can be lifelong. So these are the things which I think that you must understand before we take up postgraduate specialization in surgery. Uh, I think one of the reasons that I choose to talk today is that most of us during our time, we don't have masters of surgery yet. And just for record sake, I think the Masters of Surgery they started in UKM. Yeah, they started first, then later followed by UM. I was the first batch of the UM Master of Surgery. But most of us, we went to UK to do our fellowship. I did my part one in FRCS, which I failed. And I think I failed twice for my part one FRCS. So I passed on my third try after a lot of tutelage by people in Pusat Perubatan Universiti Malaya. They called all the old lecturers, and they brought us for around, I think, for about 1 year. And after that, I passed my part one and so on. So I think most of the concept of the father of modern scientific surgery and the father of modern surgery sort of is being credited to the people in UK, as you can see, not people in United States of America. As you can see that John Hunter, 1728 and 1793, was regarded as the father of modern scientific surgery because he did his own experiment, secret experiment, and Lord Lister, uh, very much in Edinburgh and so on, 1827, 1912. So he's a surgeon who sort of work well with the anesthetist. That's why even though most of us we have some fight with the anesthetists, but in the end, surgeons and anesthetists, we are like brothers or brothers to sisters and so on. And I'm not going because I'm a neurosurgeon. I think I'm also the one who started the radio surgery for the whole country. We started in last time in Hospital Kuala Lumpur, has gone to Institute Cancer Negara, and has gone also going to go to the East Malaysia soon. And John Hisham Gibson is the one who's doing for the open heart surgery. So for now, I'm coming back to the part, how do you affirm your decision to do postgraduate? First, you must make a conscious decision. Number two, the reason why I sort of try and I am so relieved that I'm being allowed to talk today because I'm think because of my age, because of my profession, I'm a battle scarred veteran. I failed many part one exams, not that many part two. Part one, I failed many, and I had problems to do publications. It's not easy to do publications, so I think maybe we can share our secrets later on how can we pass our exams. And most important is that the ISSSR too. How do you initiate? First, you must initiate. Then once you initiate, you got to start, you got to sustain. Sailing is very important. The sail part, because you all know that this is like what William Osler asked people when they wanted to do postgraduate. It's like you are sailing in an uncharted sea. If you sail in an uncharted sea, there will be a lot of challenges within ourselves and the external environment. So definitely for those who's going to take up postgraduate surgery, that sailing part is something that you all can share, you all can discuss, and you all must make sure there's a lot of internal help. There's a lot of feeling that something or somebody or the creator of this world is helping us to make sure that we can reach our destination. So the part of being proactive is not just to look around to make a conscious decision, but also that sailing part is going to be something that we all can learn together. So I'm going now to the poem that the road not taken. This one I think maybe we can just take the first part and the last part. So the first part, two roads diverge in a yellow wood. I'm sorry, I could not travel both because when you see whether you should take up surgery or you should take up medicine or you should be a general practitioner or maybe you should, like I got a few students from UITM days, you should take up politics, then there are the divergence in the road and you got to make your decision. And the conclusion is that I took the one less traveled by and that has made all the difference. So it's up to us to interpret what we mean by I took the one less traveled by, and that has made all the difference because I still think that in my own big family, I'm from Terengganu, my wife from Kuala Lumpur, and also from Perak and Johor. That I think I'm still the only surgeon in the family, but inshallah, uh, maybe my son will be a surgeon also. So I think there are not that many in even in the family who took up surgery, even in my own family. So I think that one is really like me. I took the one less traveled by, and that has made all the difference. So these are the things that you all should reflect on whatever you are going to do. So I think the pathways, if you can see that you can do MEDEX first, and then you can have marks if you want to do your masters. For MRCS, you say it's about 5% now. For MedTech, it's about 15%. That is the total marks if you want to do Masters of Surgery. When we wanted to discuss whether we can accept you for the Masters of Surgery or not, then you can go on your own for FRCS. Like me, I took up FRCS first. Before I sort of passed my masters, I've already had my FRCS, the final FRCS in Edinburgh. Then you can have an FRCS European. Then a few of our friends has gone to take up the USMLE, the medical licensing exams that they can be trained in United States of America. This one happened to our friends mostly from India and also from Singapore. And once we have gone to America, they have got there are areas which are quite strict and areas, especially the central part of America, in which they need a lot of people. So there are areas, states in America in which once you have passed the USMLE exam, you can train there. Then Australia, as you all know, you have got the FRACS. So I think the Bloom's criteria always put up the three components: cognitive, psychomotor, affective. And even though most of us, we are not very happy with the Bloom criteria, but in the end, despite our criticisms, we always go back to Bloom's also. That is the cognitive, psychomotor, and affective. As you can see, like Azharawi said, before we can start to operate the skills, you must have the cognitive part. And as surgeons also, we all know that surgeons, like me, I've lost many patients, and sometimes our attitude, our values change after patient died on the table, after sometimes patient died when they are on their way back, after when patient died at home. This really change our values and so on. So as you all know that on the knowledge level, we can divide the competency level from 1 to 6. Number one, no specific knowledge, and number six, no specifically in uncommon scenarios. There is knowledge, then you go to skill. Skill number one, no experience expected, and number six, able to perform without assistance, including clinical decision making. Usually, this one happens when you have complications in surgery, and most of the time, if you do any surgical intervention, we always in the back of our mind, we always know that the complication can happen either immediately during the operation table, either from medical, either from anesthetist, either from our surgical field, or maybe it's a early complications or late complications. But understanding that clinical decision making will preempt us to make sure that we can manage that. So dah ada kalau dua part of the blooms dah siap dah, knowledge dengan skills. I'm not going, because I don't think I have enough time. I'm not going to go into knowledge. Knowledge ni I think you all should know much better than me. Of surgery pun hanya before I forgot, uh, critical care is a very important component of surgical exams. Anesthetic management, metabolic and nutritional support, post-operative complications, especially the anesthetic management. So we would like to sort of to maybe to share with the wannabe surgeons that if you can do anesthetic posting, or you but don't get married to anesthetic MO consultant that is outside the scope of this talk, try to be there. Or if you want to, maybe you have some time after your operation, try to join your anesthetic colleague. And when you sort of be with them for the anesthetic management, try also to go back and read on the books. And when you sort of learn how do you anesthetize the patient, what you do to make sure that the blood pressure, the heart rate, and the temperature during the procedure is being managed by them, then you can really appreciate whatever they are doing. In actual fact, they are very important to us. They are the one who really help us to make sure that our patient can have excellent outcome. Without anesthetic support, without our anesthetic colleague, we are not going to achieve whatever we have got this excellent outcome. And if you want to assess your excellent outcome, you must go back to our own mantan Dr. General Tan Sri Hisham. When he was doing his thyroid in HKL last time, his QSUM come of some of the complication for thyroid operation is zero, and there's still a record. That's why Tan Sri American choose Tan Sri Sham to be the Doctor General, because his complication is almost zero or is zero, because he really choose his patient. He makes sure that before the operation, the complications are being taken care of. And his most important friend is anesthetist. Or sometimes you can do your operation with local anesthesia, so you can minimize the complication. So okay, uh, the principle of surgery, I think you all know about this, surgical techniques and tourniquet. But most important also, you must understand the management and legal issues in surgery. In a smaller letter, evidence-based surgical practice statistic. You must know statistic. You must have the non-technical skills. You must have got the medical legal aspect of surgery. As the head of neurosurgery of HKL for I think for about 3-4 months before I went to Mecca and become the academic head for the whole country. Uh, I got a few patients in which I was involved in a medical legal aspect, and I think if ever anybody works in HKR, if they don't go to the court and talking with the prosecution and the judge, then you are not a surgeon. I've gone to Johor, I've gone to Kedah, I've gone to Kuala Lumpur, in which we become either being prosecuted or sometimes we are the expert witness. But Alhamdulillah, I think one of the important strength of KKM is that we never lose our case lah, because of our preparation. So lepas tu you must also the clinical microbiology, you must know the emergency medicine and management of trauma. It's good for you to go for the posting also in emergency medicine and also the principle of surgical oncology. So I'm not going to talk too much about competencies sebab ada knowledge skill courses ni. Maybe I would like to share with you all. If you want to go for postgraduate surgery, you must go the mandatory course. There is a basic surgical skills, basic life support, science of tissue management. This one is very important because this one will prepare us to know whatever we are going to do in our later part of our journey. Then you must have a good documentation, circle portfolio with evidence of rotation. You must have your trainer's report. You must have end posting assessment. You must have publications, which I'm going to reiterate at the end of my discussion, presentation, and other achievements. And assessments, I'm trying to suggest we must have our sort of a personalized and sort of our own assessment. Even in the Kementerian Pendidikan Tinggi now, we ask the universities, especially the research universities, UKM, USM, UPM, and UTM, to have got their own self-assessment before we go and check. So I think we are going to go to the how can we evaluate the learning activities. I don't think I'm going to talk too much on this because it will take time. Prof. Sharifah, masih ada berapa minit lagi?
You have about another 3-4 minutes, Prof. Dato', but you can have 5 minutes if you still have plenty.
Okay, sebab kalau contohnya kalau I think all of us have done acute appendicitis, dia akan ada, if you see that, dia akan ada cognitive, ada psychomotor dengan ada affective. This one you can discuss with my fellow surgeons now. During our time of Masters of Surgery in PPUM last time, we used to operate about 3 to 7 appendix or maybe 8 appendix when we are on call. So at that time, I got to declare that we don't know what we are doing. We don't see the cognitive part, we don't see the psychomotor part, we don't see the affective part. We always think about operate only. That's it. We always think about obtain consent, we perform safe duty checklist, tak check pun safe duty checklist. We prepare patient, access, dissection, closure. Communicate pun jarang. We don't communicate. We ask the nurses to do that. So we are not very good surgeons sebenarnya compared to you all. So now since we are not really being prepared, it's not the fault of our boss, it's our own fault. So now kita dah buat ada cognitive, ada kita nak tahu you all must know the knowledge part, symptom, anatomy, variations, ada causes, preparing for surgery, asepsis, principle antibiotic, elements of consent. Hanya I just got to remind you all lah. Before I can pass my part 1 tu, I think I dah hafal my RJ last, I think not 1 times. I think 3 to 5 times lah. Masa hafal sekali, 2 kali, masih fail exam lagi part 1. So I think these are the things that you all masih lah. And then now, with the Bloom's criteria, bukan saja kognitif, psychomotor, ada juga ada affective part. The affective part tu, the professionalism, the insight, and macam mana kita boleh make our decision. Itu appendicitis. Number 1 ialah we must analyze balik what after we have done that appendicitis, what is the positive part, what is the negative part, what is the negative passive, and so on. Since this is quite long and we need to have a latihan dalam kumpulan, or we need to have a question and answers, so I'm not going to talk too much. Tapi ada yang positif, ada yang negatif, ada yang negatif pasif. Kalau for all these things yang we are going to do for the surgical training in the future. But I'm very very sure masa kami pergi melawat universities yang doing all these masters of surgery, they have got this inside their training program. Then number two is that kalau upper GIT bleed. Upper GIT bleed is something because it sort of demonstrate how you work with your colleague, how you work with the anesthetist once the BP has gone down, you need to intubate the patient, and how do you work with the blood bank, and most important, how do you inform the family about the effective counseling for family members and updating them of patients' progress. About the upper GIT bleed, I think we have lost a few of our own staff when I was in hospital Kuala Lumpur to this upper GIT bleed and so on. So I think once you've got this into cognitive, into psychomotor, into affective, and you must couple that with the positive, negative, and the negative passive. So negative passive, if you want to see, is the things that may be forgotten or omitted that constitute incorrect or substandard patient care. Things a trainee might forget to do. Ini macam dia tak identify underlying cardiopulmonary condition which may affect patient's condition. Atau failure to obtain relevant drug history. These are the things yang when you go for the formal training, then we will try to share with you on how can we do this. Most of these things is being done subconsciously or subliminally when we train our own trainees. So I think these are the things untuk training. Then as you can see juga, not because you are doctors now, not just ataupun if you are the final year students, you have gone beyond just the historical presentation. Now you are going to go for case-based discussion. So as you can see, the training should be able to demonstrate double nombor 1 sampai number 10 tau. It's not just one. Nampak one, clinical assessment, diagnostic ability, management, investigation. Number 4, clinical judgment. Ini tak ada sangat dalam undergraduate. Interpersonal and communication skills. Teamwork. Documentation and record keeping. Tapi most important, reflective practice and writing tu. Leadership, autonomy, and responsibility. For example, if you go to the sick hospital, how do you do your surgical posting and so on? And most important, ethics and professionalism. Because as you can see now, there are many instances which are reported in the social media that our own doctors, our own specialists, maybe people like me also, sometimes we don't practice according to the code and conduct of MMC. So these are the things that we all should improve. So maybe ada lagi 1-2 minit lah. And this my own personal sort of conclusion before I go to the formal conclusion. The bigger picture, if you want to take up surgery, the peers to each other, the friend which can sort of dulu masa saya dekat Terengganu, the one who sort of convinced me to take up surgery is Datuk Dr. Jamil Abdullah, who was once ketua surgical, I think about 5 years ago. Now he's in private, but I just saw him semalam pas sembahyang salat asar di Terengganu. I was on call di Terengganu semalam. He, after we prayed sembahyang asar Jumaat dekat masjid, he talked to me, Zubaidi, ada lagi mesti buat on call ni. Mana dia, walaupun he's about, I'm 62, dia about 67 kot. When he saw me dekat masjid, mesti on call. Sebab kalau tak on call, tak pergi masjid. So kami kalau on call di sebelah Surandor Zahirah, usually we'll do our Zuhur Masjid Ladang, our Asar Masjid Khalid Al-Walid. So you must have good peers. But he's the one, as a registrar dekat hospital Kuala Terengganu, he's the one who influenced me to take up surgery. So your peers must be there. Kalau seorang-seorang memang susah. So satu, location. So location is very important because I think there are certain places. Kuala Terengganu is very well known as a place which sort of a produce surgeon. Yang paling terkenal, the surgeon daripada hospital Kuala Terengganu ataupun hospital Sultan Zahra adalah Tan Sri Syam sendiri lah. Tan Sri Syam, you ask him, he always tell people that he always respect Datuk Jamil. Then he was trained dekat Hospital Terengganu, and facilities also. So saya put sana good people in a good location with an inspiring ambience with excellent facilities. They are the one who sometimes can get everything to do postgraduate neurosurgery. And the last part would be about my UKM batch 1980 and 1986. A few of my batch is still working. One is the head of interplanetary medicine in Sunway Hospital. He's a don't need to mention name lah. He's a Tan Sri. A few of my batch ada dalam GP practice ramai. Ada seorang, ada juga yang masuk politics, ada juga yang jadi CEO of IJN, tapi dia bukan dalam surgical. But before we start, the majority of us were from the rural and B40 group. And in our family, most of us are pioneers in taking up medicine. And this other year, I think Rahmat Jamal punya batch, my batch dengan the batch, side punya batch after us. These are the years in UKM. Hazim punya batch, I think dia dah hantar UKM. The government decided not to send the medical students overseas for that year. So most of the good students will send either to UKM or PPUM. And because of that, I think for our cohort, more than 70% pursue postgraduate studies. I think the last count, more than 120 of our batch, more than 85 to 89 become specialists either in public health. The current pengarah Jabatan Kesihatan Negeri Selangor pun is our batch, walaupun dia pun macam saya juga, we are retired, he's still the pengarah. So I think these are the things that maybe the government should listen, should try to contemplate why our batch, I think we are mungkin juga dengan batch dekat UM at that time juga, why most of us become a specialist. So officially ini yang saya punya the future lah, the conclusion. We would like to suggest a self-scoring system. Maknanya sekarang ni I think there's no point for us to go to your place. You do your own self-scoring system. And if you are very keen to do surgical or whatever is surgical discipline, you can talk to us, we can help you. But most important, when I put the name daripada Hippocrates sampai tadi pada Apgar tu, all of these people, they write, they document. Itu sebab sampai pada kita tu, whatever Galen wrote, whatever Hippocrates wrote, whatever Az-Zahrawi tulis, whatever Ibn Sina tulis, you all, if you want to talk up, if any one of us wants to take up postgraduate, whatever it is, please write. Then the last part, meeting the mentors gradually. I'm so thankful to Allah SWT. Yesterday I met my mentor, Datuk Jamil, after the answer prayers. So itu yang kita jumpa our mentor. Kalau boleh, at sesiapa yang ambil surgery ni, make sure that you have got your own mentor. Tadi itu saya dapat saya. Wabillahi taufiq. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Dato' Zubaidi. It's very, it's actually very relatable to me as well, because I also had a chance to work with Dato' Jamil when he was the head of surgical department in Terengganu, and sekejap with Dato' Isham, and I managed to assist him for his thyroid surgery yang meticulous too. So I can relate to what you're saying. So I totally agree. In order for you to do something, number one, you have to be inspired, and number two, it has to be affirmed with your own decision. Yeah. So we're gonna, like I said, leave the Q&A at the end. So without delaying further, I will ask if Dato' Hazim can start his presentation, and followed by Prof. Azlina. Then we can collect all the questions at the end lah. Okay, Dato' Hazim.
Okay.
All to you.
Assalamualaikum dan selamat pagi. Salam sejahtera dan salam Malaysia Madani. So first and foremost, terima kasih banyak to the organizing committee for inviting me to give a talk on the career pathway in obstetric and gynecology this morning. I will not be very extensive as the Datuk Zubaidi. He has shown that he can talk for showing that his experience has come in and all that has come out. I think banyak lagi tu nak cakap tu, tapi I think because of the time constraint, I'll be very brief, and I will just touch on a few things and probably share with you on the National Postgraduate Training Curriculum. I think one of the most important thing that I think everybody have to understand is that whether they really want to be a doctor in the first place. I always tell my new doctors that come in and report to me is that the first thing, the question that I will ask is that you jadi doktor ni sebab apa? Why do you want to become a doctor? Is it because your parents asked you to become one, or is it because you really want to be a doctor that doctors patient, or you have some other things that you don't know what to do because your career is you excel so much in academy and you subsequently wants to do doctoring? Maybe I just highlight some perspective on what doctoring is all about. First and foremost, kalau kita faham, if you produce something, we deal with a lot of equipments kan. We drive cars, we drive motorcycle, kita drive, we use television, we use refrigerator, all that are created by people and humans. And bila you create something, you have to maintain them. They will go into a problem and you have to solve their issues. So what is unique about doctoring is that kita pun maintain, but we are actually maintaining creation of God created human, and human are maintaining themselves. Macam mana nak maintain human? Because humans also have problems kan. They have heart yang fail during the they have brain which have tumors, and of course they have birthing canal which has issues kan. So siapa yang akan maintain? So we are the one that has been privileged and been given the honor to maintain humans. So it's a different scale of a job. You have to look at it. I always ask them to look at that perspective. So apart from just taking it just part of your career, it is also a privilege to be somebody that can maintain a God creation. So something that you can think about and probably look at that perspective, then probably you will look into a better way, mungkin can inspire you to work in a different perspective rather than just for monetary gain ataupun because you have to do the work and so on. Because when it comes to about macam kita jugalah, when we send a car to a workshop, we want the best mechanic to actually manage our car. Ataupun if we have problem with our refrigerator, we want the best person to come and settle it as soon as possible with the less cost, and we can get it up and going again. So it's the same thing. I think if human goes into a problem, they have issues with the heart, with their womb, ataupun they have bleeding issues, especially in women. So they wanted to settle it very fast. So I think as you go along and you develop maturity by engagement of patients. So and workshop ni juga, you tengok the more mekanik yang terbaik yang you nak pilih is mekanik yang paling banyak buat kerja. You takkan pilih mekanik yang baru graduate kan, baru pass jumpa, you akan pilih. Sometimes they have high academic qualification tapi engagement dengan kereta tak banyak. Mungkin duduk dekat office doing some academic statistics and buying parts and so on. Tapi the people who are doing the job that deals with your car is the one that you actually want them to see and settle your car. So I'm giving that analogy so that you have a perspective that actually we are actually maintaining people. We are maintaining and make sure they are functional and back to the society. They can be a mother, they can be a parent, they can actually function. If they work, they can actually contribute to the socio-economic status of the country. Okay, now coming back to the ONG punya issue. Okay, so as you know, ONG deals with obstetric and gynecology. Kita involve mother and also a child. It's a birthing process. Unique about obstetric is that it doesn't really actually points toward issue with maintenance. It actually issue with production. Okay, so we are actually ensuring that mankind continue to exist. Okay, and then we actually continue to make sure that our population grow, and then we can of course make sure that there's continuity of life. Okay, so it is something that unique that in obstetric and gynecology. So it is more of preventive type of service. Okay, rather than you have appendicitis, you come and you want to get our appendix removed, and you will heal. We are more or less try to prevent a birthing process that goes into a different pathway which end up with complications. So that is the modus of our operation. So as we all know, there are about 500,000 birthing deliveries that occurs in our country. So now we are actually a bit worried if you have seen the past few months, there were also issues with our total fertility rate has come down, kan? So initially in 1970s, kita tubuhkan LPPKN untuk make sure that kita control the population. There are so many children, they are poor spacing, so there will be increased death because of uncontrolled and not proper antenatal care. Now we are coming towards where there is not enough replacement. So our total fertility rate in the country now is about 1.6. That means if you got married, okay, and you have our family size is about just average about 1.6. There's no replacement. You should have at least two in order to sustain the amount of people in your country. So this is the issue that we are grasping now. But back to the issue of obstetrics and gynecology. So the purpose of our existence is to make sure that the population continue to grow. So not to stop the population growth, but if we need to, we have to just advise them to space out, but still grow to make sure that mankind and our country continue to exist. It is important for us to ensure that our country is population size increases, because not only it contributes to growth of the country, but also as a replacement. Okay, if not, then eventually you will end up working until your 60s and 70s, because there's not enough young people to work for you. All right. So when do you actually decide to do obstetric and gynecology? If you want to do ONG, you can actually decide even if you are undergraduate or when you are actually working. Most of the time, I find that it's not easy for you to decide what you like. It's just that sometimes you are in that particular field, you have been there, most of the time you're already knowledgeable. You can end up doing the specialty. ONG. So ONG is more on production. See, some people go into the specialty because of monetary gain. If you are talking about monetary gain, of course, birthing process will never stop. Okay, there's always marriages that occur, even this week, next week pun ada. So there's always people trying to conceive and try to get pregnant, kan? So in terms of monetary gain, I think I mean other specialty probably will have issue of preventive, kan? Kalau macam you will talk about physician, people want to prevent hypertension, people want to prevent diabetes, but nobody wants to prevent pregnancy, kan? So unless they have already completed their family or they have reached to the end of their reproductive life, okay, reproductive age, okay. So if you talk about accessibility and in terms of workload, ONG has the most workload, because in terms of the workload in Ministry of Health, we actually caters to about 25% of our workload that the ministry is churning out to all the our country, to the country. Okay, so of course obstetric is another segment of gynecology which deal with the actual disease of women, whether they have early pregnancy problem or whether they have bleeding issues, when they reach perimenopausal they have tumors and cancers and so on. So basically, you can actually apply once you have reached the stage where you finish your housemanship. That is about 2 years. But in order for you to apply, you have to have at least 3 years of assessment of your we call it SKT, sasaran kerja tahunan, penilaian tahunan you have to have at least 3 years. So usually only on the 3rd or the 4th year you'll be into the program, okay, and the program actually will last for about 4 years. So that is how it actually turns out. I will share with you the national postgraduate national careers to give you an outlook how to apply for ONG. Yeah, just remind me of my time, ya, kalau boleh. Okay, I will just show you this part of the process. Okay, now if you can see this, Boleh tengok Can you see?
Can.
Okay. Uh,
Boleh besarkan sikit ke atas sini?
Kejap. Try kejap. Is it okay?
Okay, better.
Oops. The next. Okay, wait. Okay. This is all available in your National Postgraduate Medical Curriculum booklet. So you can get it. I can share it with the organizer. So kalau you nak, you can actually pick it up from them and read. I think all uh, the process, why you want to become a teacher, what is all in this all about, how to apply, and then how is it in our healthcare service and so on. It is already in this booklet. Now, if you want to be an applicant, there are two pathways. Okay, one, you can go to the MOE, MOH. There is a Ministry of Education and MOH pathway. The other one, you can go through the MOH and MRCOG parallel pathway. So, apa beza these two pathway? The first pathway involve Ministry of Education, meaning the universities. There are actually 5 universities that actually run this program: UKM, USM, UIA, as well as now I think UITM is in the pipeline. I hope that they actually can start taking master student by probably the next intake that's in July. Now, the MOH MRCOG parallel pathway is basically a pathway that is governed by the Ministry of Health. Okay, Ministry of Health, all the trainees, they take the international exam of from Royal College, and when they have passed all the 3 parts, they eventually are gazetted and become a specialist in the ministry. So when we started off in Malaysia, we have this MRCOG pathway dulu. That was one started. When that time there was no master's program that's running the specialist education program yet. Okay, so subsequently now we have 2. Now, what are the difference between the prerequisite to actually apply? So in a MOE and MOH pathway, you have to attain satisfactory pass in MEDEX. So you have MEDEX every year. So you can take the MEDEX, you pay I think about 900 ringgit, and you can actually to have band 4, 5, and 6 in order for you to actually get considered pass and actually can apply for the MOE and MOH program. Now, then this MEDEX exam, if you take, let's say during housemanship, pun boleh juga, because you can actually last for about 3 years. Okay, the exam that you take, if you pass, you can actually use it to apply for the next 3 years in a row for your MOE MOH pathway. And then second, of course, you have to register with the Medical Development and Training Division at MOH, atau kita panggil BPL, bahagian pengurusan latihan. So this is the one that will allow you to go for your cuti belajar bergaji penuh. So you can register and you can apply, and they will also offer you hadiah latihan untuk program beasiswa untuk program ni. Of course, you have to be bonded after that. And then, of course, you have to apply to the respective universities. Then during the process, once you have applied to bahagian pengurusan latihan, then there is already a conjoined board now, so that actually will look into all these candidates that has been passed by the bahagian pengurusan latihan untuk kita sorted out which university they are going to go through. So the process will be involve an interview process. So let's say kita bahagian pengurusan latihan peruntukan 100 placement untuk tahun ni. So everybody applied. So there are 150. So 150 people, then they have to go through the interview process. And then from there, we will decide who are the candidates who are successful. Okay. So the conjoined board for postgraduate training in obstetrics and gynecology consists of all the universities that involved in providing the program, as well as the Ministry of Health, who is also a partner in running their program. Because most of the time the candidate comes in, bila they're successful, 2 years they'll be posted in the Ministry of Health, then 2 years subsequently, in the last 2 years, usually in year 3 and year 4, they'll be posted in the universities. Okay, so once you have achieved and be successful, then you have placement of training. and you'll be appointed a supervisor. The supervisor ada dua, satu supervisor from the ministry and satu lagi is supervisor from the universities. And of course, you have a 4-year structured training and satisfactory pass in all exit assessment and annual training. So this is the MOE and MOH pathway. Now, in MOH and MRCOG para pathway, okay, in order for you to enter the MRCOG para pathway, you have to pass your MRCOG Part 1 examination. So you can take your MRCOG Part 1 when you are housemanship or when you are your MOs or when you are in the ONG department. And then, of course, you have to register with the Medical Development and Training Division in Ministry of Health. So even if you pass MRC Part 1 and you don't register with the Medical Development Division, you will not be considered as a trainee. Even though you take Part 2 and Part 3 subsequently in Ministry of Health, you will not be considered as a gazetted specialist that can be considered for gazettement to become a specialist in Ministry of Health. So it's not just about passing your Part 1, Part 2, and Part 3. Now, but now there is also a bit of changes in the MOH and MRCOG para pathway. You also have to actually abide and follow the number 2 in the MOE, MOH pathway tu. You have to register with bahagian pengurusan latihan. So there is syarat baru sekarang. The third one is actually since last year October. You kena berdaftar dan in fact you kena minta HLP, okay, hadiah latihan persekutuan untuk masuk dalam MRCOG para pathway, meaning that the government is giving money for you to take exam for in MRCOG, Part 1, Part 2 and Part 3. Even they actually sponsor you if the exam is in UK, you actually can be given a sum of money to take the exam, but they only allow you to take only one exam. Okay. Now, once you have already registered with the Medical Development Division and registered di bahagian pengurusan latihan, okay, there is a MOH MRCOG Parallel Pathway Central Committee. So that is within the ministry itself. So there is no involvement of Ministry of Education in the parallel pathway. Okay, but the rest is the same. Okay, placement of training, appointment of supervisors, minimum 4 years of structured training, and then satisfactory pass of all the exit assessment at the end of the training. So final exam in MOE, MOH pathway is your final MOG exam. And of course, your MRCOG is your Part 3 MRCOG exam, which is available in our country now. Okay, kita buat Part 3 exam, I think somewhere in May, I think every year. So once you have already passed the exam, then you're eligible for gazettement and National Specialist Registry registration. Okay, so in order for you to become a specialist, it's not just passing this exam and given a CJL by the degree or a postgraduate degree by the universities or a Royal College, but you have to actually go through another process of 2 years. Okay, in Malaysia, okay, Malaysia Medical Council follow the Akta 1971 Medical Act, yang mengatakan bahawasanya in order for you to be a specialist, you have to go you have to pass your master's exam ataupun MRCOG exam, and you have to fulfill the national curriculum training criteria, okay, which include research, which include training for 4 years. You have good logbook entries, as well as you have no problem with supervisors. And of course, once you have done that, okay, then you have to complete 2 years of supervised clinical practice in ONG. So once you dah gazetted as a specialist, once you have passed as a specialist, you are not a specialist yet until you have complete 2 years of supervised clinical practice in ONG, okay, and fulfill the National Specialist Registry Logbook. That is NSR tu, that is National Specialist Registry Logbook. Once you have finished that, then only you can be considered by the law, by the Malaysian law, to be considered as a specialist, okay. Once the MMC has given you that National Specialist Registry number, then you are okay considered as a specialist in that particular field. Okay, then you are included into the National Specialist Registry. So this is the process of becoming a ONG specialist. Okay, so I think that's about it that I want to highlight for ONG. I suppose if you have any questions, you can actually, because basically I have not prepared anything specific to any thing, just to highlight to you what are the ways, I mean, what are the, how you actually apply to become ONG specialist, and how actually the outlook of the service is in our country. There's not a lot of such specialty in ONG, there are only 4, because we are doing a lot of general work, because there's still a lot of areas that we are not covering in Malaysia, especially in Borneo, Sabah and Sarawak. So it's a very satisfactory and fulfilling job, because you actually get to make sure that people who wants to develop family are safe and well managed, and you help them into their parenthood life. So with that, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Dato' Azim. Yeah, I really like the analogy that you used, maintaining the car just now and sustaining the population. I will curi that lah. Okay. All right. Without wasting any more time, we proceed with Prof. Azlina, who's going to be talking about orthopedic pathway now, and then we will convene to Q&A at the end. Okay, Prof. Azlina, over to you.
Thank you, Prof. Su. I do need Dato' Azim to unshare his screen so that
Wait.
I can share
Yeah.
mine.
Sorry. Stop sharing. Okay.
Thank you. Okay, Assalamualaikum and good morning, everyone. I hope you can see my slides. Actually, a lot of what I'm going to say overlaps with the first 2 speakers, so I'll try and move things along in the interest of time. So my name is Azlina. I'm from Orthopaedic Surgery in University Malaya. I also happen to chair the selection committee for the Orthopaedic Specialty Committee. Orthopaedics is a specialty that focuses on the care of musculoskeletal system. And although the word orthopedics was first coined in the 18th century, but there have been evidence of orthopedic practice even from the time of Hippocrates as well as the ancient Egyptians, as depicted in a number of hieroglyphs as well as old text. In Malaysia, the history of orthopedics not that ancient. In 1949 was the first orthopedic unit that opened in KLGH, currently known as HKL, and this is after World War II. Prior to 1949, orthopedics was a section within general surgery. So a lot of people who had orthopedic injuries or deformities or musculoskeletal infections were actually treated by general surgeons. In 1958, Tan Sri Abdul Majid Ismail became the first Malaysian orthopedic surgeon after obtaining orthopedic training from Liverpool. And Tan Sri was actually a qualified general surgeon who obviously had interest in orthopedics, hence furthering his studies. And following Tan Sri, many other Malaysians followed his pathway to orthopedic training by being sent to Liverpool for training. At around the same time, within that same decade, University Malaya was formed in 1963. And the first orthopedic department of was formed in 1966, and it was headed by an expatriate, Dr. J.F. Silva from Sri Lanka. So HKL and are basically the oldest orthopedic departments in the country, in Ministry of Health and in academia. In 1967, the Malaysian Orthopaedic Association was formed, and this society now represents a large majority of orthopedic surgeons in our country. In 1985, the first batch of Masters in Orthopedic Surgery trainees graduated from University Kebangsaan Malaysia. The head of department at that time was Prof. Qazi Iqbal, who was from University Malaya and moved to UKM in the late 70s. And he was the one who drove the initiative to start clinical surgical training, or master's surgical training. followed suit in 1989. Of note, for the ladies out there, in 1988, Professor Tunku Sarah Ahmad became the first woman orthopedic surgeon in Malaysia when she joined the department in University Malaya. And years later, in 2003, 2004, the Conjoint Board of Orthopaedics, now known as the Orthopaedic Specialty Committee, was formed. So you may a lot of people think orthopedics are carpenter of the body. The analogy with the car engine is what I always use for, because I do joint replacements, so I use car tires as my analogy. But a lot of people, again, when it comes to ortho, oh, you're the carpenter. And actually, in orthopedics, we do a lot more than just carpentry. We do a lot of things. And if you're wondering whether orthopedics is maybe a field for you, some questions to ask. And I realized that a lot of these questions overlap with all the other specialties. You can apply it to ONG, you can apply it to general surgery. So your ability to apply scientific theory to your practice in an effective way. Are you able to think on your feet and be flexible in managing patients in emergency situations? The third question probably may be more relevant for orthopedics. Can you see beyond the patient's injury to their recovery, rehabilitation, and return to society? And as with any surgical field, you need excellent hand-eye coordination to enable you to use the most basic to the most technologically advanced equipment. Well, what are some of the top reasons to do orthopedics? I think for me, I find that orthopedics is very rewarding and satisfying because I see almost immediately how my interventions or any interventions that we do for our patients, whether it's operative or non-operative, rapidly improves their quality of life. So this is a video of a gentleman who had his hip replaced, and within 2 weeks, he's quite fast. He's walking unaided, and he's back to work as a boilerman in a factory. Another reason for some people to do orthopedics, well, actually, there's a wide range of subspecialties to choose from. So if you're not interested in joint replacement, well, we have upper limb and hand and microsurgery, spine surgery, sports. We treat patients from the very young to the very old. There's orthopedic oncology, there's trauma, especially in our country with lots of motor vehicle accident rates. And there's also a foot and ankle specialty. So literally from the neck to the toes, there's something for you. In orthopedics, we allow application of scientific knowledge to clinical practice. So although the impression is carpentry, but actually we don't just tinker around with screws and drills and hammers and nails. There is abundance of research in tissue engineering, regenerative technologies, looking at how we can recreate muscles, tendons, bones, etc. There's a lot of research and clinical application with using 3D printing, whether it is for surgical instruments and guides, or even 3D printed customized implants for patients. And in this day and age, robotics is also playing a key role in improving surgical outcomes. The specialty has a wide interaction and has multidisciplinary team sort of outlook and interactions with industry. And there's a lot of support from professional bodies, and we have a pretty good, well-organized training for any area of specialty subspecialty that you're interested in. And just like everybody else, we are very sociable specialty. I think the other thing that people think of orthopedic surgeons, we're very laid back, and actually we don't take ourselves too seriously. We are not shy to walk around in sarongs for dinner, as you can see in the picture up above. And we do interact with many others in our specialty and beyond, not just in the region, but also worldwide. So focusing on orthopedic training in Malaysia, it is overseen by the Orthopaedic Specialty Committee, which is basically the conjoint board. At present in Malaysia, there is only the university's master's program. If you want to be an orthopedic surgeon in Malaysia, there is no parallel pathway for orthopedics at the moment. And this program is offered by the 8 universities who are members of the Orthopaedic Specialty Committee. In brief, the training is a minimum of 4-year training program, a maximum of 7. We have an annual recruitment of 100 to 110 trainees per year, and who are placed around 35 accredited clinical centers. There are 200 accredited orthopedic trainers at the moment. The structure of training is divided into early and advanced years. The early years, you focus primarily on general orthopedics or trauma, and the advanced years, you're looking at advanced trauma and subspecialty rotations. And to complete the program, you need to have satisfactory marks in end of posting tests, supervisor and trainer reports. You have to pass your exit examination and satisfactory outcomes with your research dissertation and publications. So focusing now even more on the selection for postgraduate orthopedic training. As we know, postgrad training in any field is very intensive and focused. If you imagine there's only 4 years for you to be recognized as a specialist in a particular field, you really have to come in to a program running. You cannot go like, I'll learn all this once I'm in master's. Actually, no, that learning has to take place well before you join master's training. The other reason why we have a stringent selection regime is because applications to the program outnumbers the seats available per year. So although we can take 100 candidates every year, but every year we get 400 applicants. So naturally, some people will have to be disappointed that they're not able to join for that particular year. We don't take selection very lightly. We have to be very careful with how we select our candidates. And so the selection process that is in place for orthopedics is designed to test the candidate's ability to apply basic science and orthopedic knowledge in their clinical practice. The general entry criteria, obviously, you have to be a doctor who is able to practice in Malaysia. You're registerable with MMC. And although we said that you have to have a minimum of 6 months experience, it doesn't mean that the moment you have 6 months experience in ortho, you're automatically ensured a place in postgraduate training. You really have to earn that spot. As with all programs and most universities, the age at the time of application, you have to be less than 40 years. And you need to fulfill the various criteria set by your respective sponsoring body. So whether if MOH is sponsoring you for masters, then you have to fulfill their criteria. If you're going to be an academic trainee with the university, a trainee lecturer, you need to fulfill the university's requirements to join the program. As you've heard before, everyone has to sit for MEDEX and achieve band 4 to 6. And in our case, once you get MEDEX band 4 to 6, you then move on to the actual selection process. To enter postgrad, every potential trainee needs to do 2 things. One is you need to actually apply for the orthopedic training program. And number 2, you need to go for the selection process. So if you didn't apply and you just go for selection process, you're not going to get into masters that year. All right. So you need to do 2 things. You need to be clear on that. You cannot say, oh, I didn't know. So the first step, apply. If you're in Ministry of Health as a MOH medical officer, you wait for MOH to advertise through their BPL. All right, and you apply. If you plan to apply directly to the universities, and this includes public universities as well as the private university, you go directly to the university. And these are either self-paying candidates or candidates who intend to be trainee lecturers in that particular university. The second step is the selection process. And for orthopedics, the selection process is 2-step. First is the MEDEX, and the second is the actual selection event. So application, like I said before, MOH, you go through BPL, wait for the advertisement and apply as per their instructions. And for university candidates, you go directly to the university of choice. My recommendation is try to apply about a year or so before your planned entry. So if you're planning to enter masters in 2024, by this time, your application to the university should have been submitted and began its processing. Do not apply 3 months before the master's intake, because that will not allow the university time to process your application. And you may find that you may not be able to enter in 2024. If you submit in early 24, most likely your entry will be in 2025. As said before, you need to fulfill all the criteria required by the respective university. And although intake is usually once or maybe twice a year, depending on the university, the application process, you can submit your application anytime throughout the year. So as mentioned before, the selection process has 2 components, the MEDEX, which is a best answer question format, and the selection for postgrad orthopedic training step, which involves OSCEs, vivas, and multiple mini interviews. So MEDEX is an examination that is conducted by the Majlis Peperiksa in Malaysia, and for orthopedics, it's conducted once a year. It consists of 100 best questions which are to be answered in a best answer question kind of format, and it covers anatomy, physiology, pathology, principles of surgery, and biomechanics. Just to highlight to you, just as what Dato' Zubaidi mentioned before, we're not only just looking at anatomy, physiology that's related only to orthopedics. You need to know everything about your patient. So there is anatomy or maybe physiology related to cardiovascular, respiratory, endocrinology, etc. MEDEX is a 3-hour online examination, and the registration fee is 800 ringgit payable to MPM. And whatever results you get is valid for 3 years. So if you have hit your band 4 to 6, actually that result is valid for 3 years. And which also means that if you are planning ahead and you foresee that your master's intake is going to be in 2026, you could actually start trying for MEDEX from this year onwards, because once you hit band 4 to 6, you don't really need to resit, because you know that, okay, by 2026, my result is still valid, I can go ahead. If you sit too early, your results expire before you get into masters, then yes, you do have to resit the exam. You can get more information from the MPM website. The website is listed there. And in the second step, once you get your band 4 to 6, you are then invited to go for the selection for postgrad orthopedic training section. This is organized by the Orthopaedics Specialty Committee. It's usually conducted over 2 to 3 days in January or February. So it's a physical event. It's a face-to-face event. It's not online anymore. We still run it out of a central region venue because we find it easier for candidates to come to KL rather than going out of town. Spot consists of 22 interactive and non-interactive stations, with OSCE Viva covering anatomy, physio, patho, principles of surgery, biomechanics, clinical and surgical skills. And the third component is the multiple mini interviews. OSCE and Viva are 6 minutes per station, and multiple mini interviews are 5 minutes per station. There is also a registration fee for this. It's 700 ringgit and it's payable to Spot or OSC. Once you've gone through Spot, there is a selection process by the executive committee of the conjoined board, which basically is comprises all the heads of departments of the universities. And candidates are ranked based on their performance in the 3 sections in Spot. And we rank them from highest to lowest, and that's how we select them into the various universities. Candidates actually can list down their preference of universities from 1 to 8, the first choice university. So if you're a very highly ranked candidate, your chances of getting your first choice university is very high. But even if you're a low ranked candidate and your first choice is all filled up, it doesn't mean you don't get in. Unfortunately, you may end up getting your lower rank or lower preferred universities for master's training. We do need your CV and logbook information. We use that to discern between, two candidates who have the same mark, and they're fighting for the same spot, but there's only one spot left. An allocation to university usually based on your institution preference, provided they have not fulfilled their intake quota yet. So how do you improve chances if you're interested in joining orthopedics? How do you improve your chances of getting into an orthopedic training program? First and foremost, use your own initiative. I echo that of Dato' Zubaidi's talk earlier. Make full use of your time, grab as many opportunities as you can to get as much exposure in the specialty of interest. So this is also applicable if you're thinking of ONG, medical, surgery, anything, right? Grab as many opportunities as you can. And you may think these opportunities are only presentable to you once you only start working, but actually once you graduate, while waiting for your houseman position, you could already start expanding your knowledge and your experience in the field of interest. So while waiting for your interviews or your posting to the hospital as a house officer, you could work as a research assistant in the orthopedic department or unit where you have been studying in, complete projects, research projects, publish or present if you can. So of course, study and attend whatever courses that you can to again improve your skills and knowledge in the field. Carry this forward also to once you start working. Be good and a safe doctor. Please try not to have disciplinary issues or action. Impress your specialists or HODs in the relevant department that you're in. Keep a logbook of all the cases that you've seen and managed, because logbooks are one way for us to also know that you've got enough exposure. But number two, logbooks are a good way for you to look back and reflect on whether, okay, what have I learned from this case? What have I learned from that case? And it improves your own knowledge and journey towards improving yourself in orthopedics. Study, attempt your MEDEX, get your courses, certificates, and put them to practice. Again, get involved in studies, research, publish, and or present in the multiple courses or conferences that are available. And if you're in MOH, achieve your 85% and above in your Laporan Nilai Prestasi Tahunan for at least 2 successive years. The more the merrier, I think. And of course, additionally, it'd be nice if you can show that you're a well-rounded person. You're not just a bookworm. You do volunteer work, you organize, help to organize courses, etc. Because it does, again, give you a different perspective on your medical training. So what helps? Show interest and be involved. Read, reflect on what you've seen, reflect on what you've read. Start to apply what you have read and what you know to clinical situations. Learn from others, so don't be shy. As Datuk said, learn even from those who have failed because or have complications, because in every one of those instances there is a learning lesson. And once you start working, start to see cases, do cases, reflect, and learn again. Okay. So how do you prepare for MEDEX and sport for orthopedics? This is our website for orthopedics entry. There are links there for you to download our syllabus, forms and templates, including CV and logbook. And even if you're not planning for masters next year, it's a good idea to download them early, because you can then start to populate your CV and your logbook right from the early stages, rather than at the very last minute stage. The syllabus is there to help you study. It guides you on what to learn and how much depth you need to learn. So similar to what Datuk Zubaidi presented, there's levels of 1 to 6 for you to know, like, okay, do I read too much? Am I reading too much into something? So last but not least, things may change over time. So don't forget to check the website for updates. So again, our website for orthopedics entry is myorthosport.com. Those are the things that you can get, and the website for MEDEX is mpm.edu.my. Thank you very much.
Thank you very much, Prof. Azlina. So a very clear, I think, as far as I'm listening to it, very clear presentation from our 3 speakers on these 3 major, I would say, surgical disciplines. And as you mentioned earlier, Prof. Azlina, there will be only one pathway, isn't it, for orthopedic?
For ortho at the moment is only one. Many years ago when we did the national curriculum, we thought there would be a parallel, but I think that's still work in progress.
Okay, all right.
Let's put it that way. There's always hope.
All right, but we know that there are more universities who are actually providing the training, so that's good.
That helps.
Okay, we are gonna open the session now for Q&A. I know we kind of like went aboard a little bit, but then we started a bit late anyway. So we have maybe another 20-25 minutes for Q&A. So far, there's only one question in the chat box. I don't know whether maybe Ashraf has any other questions. Maybe I should just read first question, yeah. This is to Datuk Zubaidi and also actually the rest of esteemed speakers.
Tak, Prof.
As your hospital,
Tak,
sorry?
Prof. Dia kacau sikit. Since Hazim kata dia nak leave early, boleh tak kita direct untuk
Question to
Q&A
Azim.
dulu? Ya,
Oh, okay, boleh. All right. Questions for ONG.
Betul nak jawab panjang tu.
Okay, I think the questions in the chat, in the box, Q&A box, is quite an open question.
Yeah.
It can actually be to any of the speakers. Maybe if there is any questions to Datuk Hazim first, on maybe the ONG pathway. Anyone?
I think the question yang from the anonymous attendee ni is regarding the SKT for 3 years tu.
Okay.
Whether it can be shortened. I think 3 years too is actually including your housemanship, kan?
Right.
So you have to complete that housemanship for 2 years. And then MOship for 1 year, because we actually think that you need, when you're housemanship, you're actually under supervision, kan? You don't make your own decision, you make analysis and you make decision, but all must be actually be counter verified by somebody else. So in that 1 year period, when you are MO, you are already accountable on your own. So whatever clinical data that you gather from patient, you analyze and you actually come up with your own conclusion. Yeah, and you are accountable to it. So we find that 1 year pun actually is quite short actually, but we hope that in that 1 year you actually gain that maturity to be an accountable, mature medical officer. Then only you can actually subsequently go into postgraduate training. So if we shorten that period, then you will just come in without any ability to actually mature in other things as well, you know, because we also want our trainees to actually also know other discipline apart from the discipline that they want to venture. So that is the reason why that 3 years period. But this 3 years period of SKT is not new. During my time, also the same thing. I had to actually be an MO for at least 3 years before I actually can venture into postgraduate training. So it's not new. Thank you.
Yeah. I agree with Dr. Azim. I mean, I know and I understand that, you know, time is of the essence and, you know, everyone wants to rush into specialty, but there is value to that waiting time because it does give you a more rich experience. I think if you're very short time where you're just an MO, you're just becoming independent, and then suddenly go into masters. As I said before in my talk, masters is very intensive. You really have to hit the ground running, and if you have not achieved a lot of independence in that first year post housemanship and you join masters, you will actually struggle through that 4 year masters training program. And we much as you know, we would love to have you, but if you're going to struggle, not that we don't want to help you, but we don't want to see people struggling, we don't want to see people suffering. We want it to be a painless, smooth affair for you. As Datuk Zubaidi's slide was, we want you to sail through the program as best as smoothly as possible. Yeah, I think the emphasis should not be so much on the timing and how to make it fast, but make that time full of quality, you know, rather than anything else.
Thank you, speakers, for the answer. I also tend to agree because I think it is nothing new. It has been ever since our time. Back then, 35 years ago, there's always years given before you could actually join any postgraduate training. And this is actually to build your maturity, like what Dato' Hazim and Prof. Azina have said. And it's also to prepare yourself, isn't it? To make sure that you're affirmed with your decision before you really embark on something that will change your life forever. I would say.
I mean, the last thing we want is trainees who come in unprepared. They struggle through, and by the time they exit the program, not because they pass, so but they struggle and they have to leave,
Correct.
you're stuck because
Yeah.
you've been in the program for 3 years, 2 years, 4 years, you know, and then you're older now and you go, what am I going to do? You know?
Exactly. Okay. If that, Dato, do you have
Yeah,
anything to add?
I think another thing that I want to touch on, another question is about whether Malaysian training are acknowledged in overseas. I think I think even we do not acknowledge training from other countries in our country. There's not just about academic issue, but there are also some economic issue as well, kan, macam Malaysia and Singapore. I mean, kita tak recognize Singapore, Singapore doesn't recognize us, you know, because if you recognize each other, then a lot of Malaysian will actually work in Singapore, you know. And these are the things that but as in terms of our, maybe Prof. Azlina or Datuk Zubaidi can actually enlighten on it. But the other thing that I was talking about is that our MRCOG pathway, we are actually trying, we have really engaged with the Royal College in UK, and they are actually in the process of recognizing our training. So that is something that is good. And in fact, once they have accepted our training as their training, we are considered as a specialist in UK. So it is a milestone forward for the ONG training in Malaysia. So that's why I think the IMU has come into the picture. But we have still a lot of work to do, but that is the beginning of something that we look forward, and if people who has been recognize our training, that shows that we have actually good breeds of doctors, we have good breeds of mechanics that can maintain people. Okay, thank you.
Thank you, Dato' Azim. Tersedak sikit IMU disebut. Well, we will try. We will try our best to ensure that we will help the national agenda. Yeah, Dato'. You would like to add on, Dato'?
Let me answer the question. I think was directed to my teaching hospital, because actually last year our university stopped the trainees going to for the training. So I think the medical officers is quite upset with the whole thing. And as a previous vice chancellor of the university, I can understand that actually is the something like, I'm not sure whether it's a misinterpreted or communicated to our university to hold on to the medical officers, because we are just starting. And we, like Prof. Azlan said just now, we wanted them to bond with us first. As Dr. Azim also reiterated about the car mechanic story tu. We have lost one or two sort of young lecturers who we accept as lecturers, then become specialists, and they have left for greener pastures just 2 or 3 months after getting their NSR, Prof. Azrina. So, but it's not from surgical discipline. So I think the after effect of that sort of reverberated through the Ministry of Higher Education, came back to us, and that's why I think there was some problem from our university of sending our postgraduate for further training, because they are quite worried that the doctors who have got their specialist sort of qualification will leave the university and they will go for greener pasture. But I think I would like to reassure the one who asked the question that we are taking solid sort of steps, inshallah, for next year. Then on Thursday, I think the Para Hospital, as part of the consortium, and also the deans of the medical school, we are trying to convince the KPT and also the JPA. JPA was inside the meeting that if the country wants us to grow with the rest of the country, they should sort of allow more people to go for training next year. So mungkin Pak Asna, you can speak to Prof. April juga dengan your pengarah hospital pun, both were in the meeting.
Yeah.
And then hanya orang KKM telah meeting tu pengarah hospital dengan dekan with the KPT and JPA. So they have got our message. Somebody macam below his top, ada something lah. So I think most of us, we are very much emotionally sort of tested in a way that we really wanted our young medical officers to go for further training, and yet seperti yang Dato' Hazim dengan Prof. Azlina sort of keep mentioning, they must be more matured and they must be more ready to keep up this mental. And I would like also to remind them that during our training last time in PPM, I think my group juga dengan Datuk Sri Wan Aziza, dengan Mary Cardozo, dengan Datuk Sri Abu Hassan and so on. Our group masuk dengan Rozman juga lah and Malik. So our group memang we don't, even though we are taking fellowship to FRCS, but yet we don't really go on the first go. Except people like Kenneth Kola, who always pass his exam at one go. Most of us, we will take about 2 or 3 exams, and we need to go to UK, we need to go to Singapore, ada juga lepas tu pergi Nepal and so on to take our part 1 exams. So I think now with people like Datuk Hazim macam trying to make sure that the country is being recognized by the College of OMG, I think these are the way forward. Yeah, inshallah, I would like to assure the trainees that inshallah we will make sure that we will contribute so that more postgraduate trainees will have more easier pathways to be sort of a future contributors in this country. Lepas tu mungkin saya nak jawab sikit yang daripada about medical legal issues and the how do you go forward with medical legal issues.
Sila Datuk.
Boleh yang tentang
Boleh.
tentang
It's in the
medical
chat.
legal issues tu, as surgeons, as neurosurgeon, memang we are very much involved dengan medical legal issues. The patient who was paralyzed from that I operated in HKI last time, that is a 6 years old baby who came in the calipees coronavirus. But if I don't operate at the 6 days of age, he will die of pulmonary complication because he was bed bound. So after taking all the consent, I operated on the patient, but as what we have seen, because the spinal cord is already compromised, and we have got that into documentation. So we sort of even though they sue us 3 times already, I think they sue KKM when patient is 3 years old. Then they just sue again 2 years ago when patient is about 12 years old now. Then the prosecutor make a scene lah, bawa the paralyzed patient to the court. Tapi because I think one of the thing medical legal issues ni, KKM mungkin Dr. Azim will know, we are being helped, assisted by the Attorney General. So I think for that case, kata kita prepare about 1 or 2 years. Mungkin juga PPUN, Prof. Azrina mungkin boleh can learn daripada KKM. When I was in HKI last time, we really prepared. Every medical legal issues tu jadi macam something that we really learn. We learn from the voluntaries. We go to what happens in UK, in America, and during the time in court, macam we enjoy tau, sparring with the prosecutor, with the judge, because in the end everybody learn from the session. Sampai I think for my patient pun dia menangis, kata tak apa, Mr. Zubaidi, tak apa, we would like maybe if there's any recent advances in neurosurgery, maybe my client can walk again even though he's paralyzed. So I think whatever it is, mungkin for the trainees, medical legal issues is something that can help to educate the judge pun, educate us pun, educate the patient pun, that with further advances in the future, sebab saya letak nama Hippocrates, nama Al-Zahrawi and so on. So with the recent ini yang panggil technology advances, I know dekat China they have started to do transplantation of a spinal cord, dan mungkin Pak Azina will know better than me juga lah. A few of my friends pun tengah cuba nak buat that transplantation in Malaysia, not officially but inside the lab so I think these are the things that we can go forward. So for the trainee medical legal issues, for most of us is something that inspire us to go further. It's not something we are afraid that we felt it can negate our perception. And sometimes I would like to thank the patient juga. Yeah, you can sue us. You can sort of make sure that you are satisfied with your experience in the hospital. But I would like to assure them we are on the same page. The same page that whatever we are doing is to help the patient. So, thank you.
I think with medical legal issues, as Datuk said, it's unavoidable. I think it's the way the world is now. People have expectations. And I think as doctors, one of the things that we have to be able to do, and I admit probably most of us are not trained very well in this, but I think that's where the curriculum is trying to address this, with looking at professionalism and the effective part of the curriculum, is being able to communicate and readjust patients' expectations. It's always scary and disheartening when, despite your best efforts, then you get a lawsuit sent to you. You get a subpoena and says, okay, and the lawyers come banging on your door. But I think for especially when you're beginning, don't think of it as that's the one that will hold you back from having a fruitful life in the medical field. I find it very helpful that one of the ways, this is what, a few things that some of my seniors who have gone through such experiences, and Datuk said it's a learning experience for all of us. They learn from painfully, and then they pass that knowledge down to us on how to prevent it. And one of it, my colleague was saying that always document, right? Document everything very well. It's not sekadar, patient agree, sign consent, but you need to be a bit more detailed about what your consent entails. It's not so much of, auntie, I'm doing operation, I sign. It doesn't work that way anymore. 20, 30 years ago, maybe. These days, you kind of have to go, okay, this is the surgery we're going to do for you. This is what's going to happen. After operation, this is what's going to happen. When are you going to expect full recovery, etc., etc., etc. So communication is actually very key. And I think for a lot of instances where cases do end up being a lawsuit, if you look back on it, a lot of it is because of poor communication. You know, somewhere someone misinterpreted something, and I think if you're very concerned, then one way for you to avoid it in the medical career is really improve on your communication skills and being able to interact well with your
Yeah.
patient.
Okay, thank you, speakers. We probably can actually take a few more questions, 2 or 3. I know someone has raised his hand there, but just to actually maybe combine a few questions from the Q&A itself. Yeah, I can see that there are many questions, but it's actually similar. Maybe if the speakers can also maybe we start with Datuk first and then Prof. Azlina. The questions about what other aspects that you would probably have to consider before you choose the kind of specialty that you want. And I guess this is not just aspects in life, but also the professional aspects as well. So, Datuk, would you like to start first?
I think talking about the specialty too, I don't want to talk too much about specialties because I wanted to be a cardiothoracic surgeon. Jeffrey has booked me
Same
a
here,
place in
Datuk. I
Melbourne
also
dah hari
wanted
tu.
to be pediatric surgeon.
Tapi your boss Tan Sri Bakar, so I got to tell you frankly, he literally forced me to become a neurosurgeon. Nah, ini sampai sekarang saya ingat lagi. So, itulah kadang-kadang mungkin nak ikut balik Prof. Azina. I know his father juga dulu pun. We all are mentored by our great teacher, our great leader. So
Yeah.
I was a victim of circumstances juga aku. Why? I'm enjoying whatever I'm doing. See, itu saja. Thank you so much.
Okay. Same with you actually, Dato. I wanted to be a pediatric surgeon, but there was no slot for pediatric surgeon. I was given ONG, so stuck with ONG.
Okay. Kita dengar Azrina pula dengan Hazif.
Okay,
Mine
Prof.
is
Azlina.
very convoluted. So when I finished medical school, I told myself, no, never. I'm never going to do orthopedics. I hate orthopedics in medical school, and in fact, I wanted to be a general surgeon. And when I came home to Malaysia and I started my housemanship, I realized, okay, maybe surgery is not for me. But I really enjoyed ONG. Even as a medical student, ONG was my backup choice. But again, never orthopedics. So I had actually applied for ONG, and in the meantime, I was working in an orthopedic department for a while, and they entrusted me enough. Can you imagine, to start doing cases, to do MO level call, even though I was a house officer, but a bit senior house officer. And the turning point for me, I think, was I was on call for orthopedics one day. It was a Saturday night. I remember it very clearly. It was a Saturday night. I was on call. I was having my dinner. And I see my favorite ONG lecturer running down the corridor and goes, "Oh, Dr. So-and-so, where are you running off to?" She goes, "Oh, I'm running to labor ward. My patient going to deliver." I goes, "Oh, okay. Are you on call?" "No." "Okay." So this was a Saturday night, 8 p.m.-ish and all that. She was not married, and she's running to deliver a baby and she's not on call. And I'm thinking, is this the life for me?
You're discouraging people from ONG, Azlina.
There is a moral to this story. So the moral of this story is that not to say ONG is wrong for you, or just because I've been through that experience. I think it's Datuk Hazim mentioned this. Ask yourself, what is it you want out of your own life? What is it you see in your, either as a medical student, either as a house officer or junior medical officer, your experiences in all the different departments that you have rotated through? Which one resonates with you the most? Which one calls to you? Which one is, you go, wow, I can see myself doing this for the rest of my life. That's the one for you. Not orthopedics, not ONG, just because we are here. It's because what is it that calls to you? Your parents may say, my dad wanted me to do ONG. He goes, yeah, it'd be very good for you to do ONG. And he was very disappointed with me for a long while. When I was in training for orthos, he wouldn't even acknowledge me as his doctor. This is my daughter. He wouldn't even see. And only after I passed my masters and I worked a few years, treated some of his patients, and go, oh, this is my daughter, the orthopedic. So before that, so that was how disappointed he was with me in the beginning.
Okay, thank you, Prof. Azila. Maybe we can take a question from PC. PC, you raise your hand. I don't know what PC stands for. Or is the person is there? Okay, if there is none, then we go back to the question and answer. I think Dato, you are trying to address questions about whether curriculum and co-curriculum and research would be good before they join the postgraduate training, isn't it, Dato?
Yes, dah jawab lah.
Okay.
Since I'm also the chairman untuk research for the whole country untuk medical dengan health science, I think when I was in Edinburgh doing my postgraduate training itu in Western General, even my houseman dia pun dah buat PhD during the houseman training in University of Edinburgh. So I think our university may not have that privilege lagi tu, but I think we all can go on that line lah.
Yeah.
So kita suka sangat ikut UK kan, so so I think try to do it whatever you are doing now, and kita on our side, because I think most of us we are trying to tell the Ministry of Higher Education dengan JPA dengan KKM juga to be more liberal lah about all these things. Then our postgraduate student will be very much more matured, and seperti kata Prof. Azlina tu bukan dia ada running tu, dia masuk masa training boleh buat marathon, dah boleh jadi hot apa Iron Man.
Iron Man, yeah. You can be, yeah.
Yeah. Okay. Is there anything else from the speakers? Because I think most of the questions we have addressed and quite similar. If there is nothing else, because we are already 15 minutes overboard. Or if there is any other questions from the audience, you can actually unmute yourself and ask the questions directly if you like. Okay, if there is none, okay, hold on, there's the last one. May I know for Euro ENT, does these branches also follows neurosurgeon pathway? Dato'?
Yeah, I think for cardio thoracic now dah UiTM dah start their masters. We are supposed to go there and confirm. Untuk Prof. Azina pun UM pun dah suruh kami dah pergi, hanya kami tak sempat nak pergi lagi. UM cardio thoracic. Euro memang dia ada dia punya own clinical pathway macam ortho juga. ENT they have got their own program. So this memang this subspecialty memang they have got their program lah. So macam dah jadi macam orthopedic semua dah. So everything macam cardiothoracic, urology, ENT, ophthalmology. So they just need about 6 months of surgery saja.
I see. Okay. All right. So I hope that answers the questions. And if there is no other questions, then I would like to take this opportunity to really thank all the speakers, Dato' Zubaidi, Prof. Azlina. Dato' Hazim has just left us for something more urgent. And also to all the participants, those who are attending this webinar and stay for 1.5 hours with us. It's been great to hear that we are moving towards what we want, and we are all envisioned towards improving our national postgraduate training, and the pathways seems to actually be wider now, and we hope that we're gonna get more people interested in doing specialty with all our national programs. So thank you so much again, Dato' Zubaidi, Prof. Azlina, and the Secretariat from MIMS and UiTM, and all of you who are listening. So hope to keep in touch.
Thank you, everyone.
Thank you.
Thanks for joining us.
Assalamualaikum.
Salam.
Okay.
I really enjoy this session. I hope
Same
everybody
here.
enjoy
Buat
this
lagi
session.
Boleh. Maybe there are more surgical based pathway that we need to venture lah.
Yes.
Okay. All right.
Thank you.
Okay.
Bye-bye.
Assalamualaikum.
Bye.
Bye.